All right. Well, hello everyone. I'm glad you could join us tonight. We got a special guest on tonight, Dr. Gerry Ross. Gerry has years of experience. As a matter of fact, I should put decades of experience using PBM. And in his practice, in his dental practice, and has spoken around the world about PBM and with a team of two other fellows. They've done a lot of webinars and teaching how PBM can best be used within their practice. But far beyond that, they have been instrumental in really advancing PBM knowledge, and we'll be sharing some of that tonight. Gerry has had a lot of personal experience being able to help others close within his family, as well as not only family but practice, and teaching people, like I say, all around the world how to use light technology. He's had, in the beginnings, he had laser technology, and because that was really the only light technology out there that had any power. More recently now with LEDs, LEDs can be equivalent in optical power or even greater in optical power, and be able to penetrate even deeper depths than was before, or what was possible before. So depending on the wavelength and that. So I'm thrilled that people are joining us tonight from England all the way to Alaska. So we thank you for all those, especially in England, because it's middle of the night right now for them to be joining our webinar. So I'll just do some little housekeeping here. Just want to say that for all those that stay till the end of the webinar, we will be registering you in our draw, and once a month at the end of the month, we draw a person that will receive one of our SunPower LED units. It's called the Super Palm 1050, and that's the one that has the new 1050 nanometer wavelength, which has the potential to penetrate a bit deeper, and actually help with different mechanisms that the 660 has not been able to accomplish. So there's some overlap, but yeah. So I want to now welcome on Dr. Gerry Ross, and Dr. Ross, if you could. There we go. Excellent. Okay, and we're going to allow and unmute yourself there.
I'm unmuted. I think you can hear me.
Excellent.
Okay.
Excellent.
So we're going to get going. I'm going to share the screen. Got a couple slides, a couple pictures for you. We're going to have some questions at the end. If anybody's got questions on anything to do with PBM, I'll gladly answer them. Just send Tom an email and he'll forward it to me. So what we're going to do is basically we're going to talk a little bit. I'm going to talk a little bit about dentistry, but just a couple things as it relates to things that everybody might know and things that might come up with you. One of the things I wanted to show is Tom said back, I've been doing it for 30 years. Well, really, this goes back to 1967. I had several occasions to run into the son of the founder, basically Andre Mester. He's the one who started PBM low-level lasers. He was just lasers then. He was working with, he wanted to know if they cause cancer, and he was treating patients from all over Eastern Europe. Why didn't we hear about this? He was in Hungary. It was behind the Iron Curtain. I'll just show you an example of what he was doing. This is 1967. This was a patient that came from Italy that had bed sores that had been treated for a full year. You can just see it. You wonder how anybody could live with this, with nothing but using a ruby laser. This was 6 months later for that lady. So this is the type of thing. This is not new. When we're talking about doing it, when I run my course, I tell it, this is what you need to understand. So with the PBM, you got two choices. At a low dose, you get stimulation. So if you want to do something for healing, you want stimulation. As you get higher doses, you do inhibition. So it really matters whether you want a low dose or a high dose. You sit and say, do I want healing? Do I want pain to go away? And we'll talk a lot more about settings and pain up towards the end for personal use. Just some of the things I did in dentistry. Like I used to do a lot of surgery. I was in a small town outside Toronto. I did impacted wisdom teeth. I did very complicated surgery, stuff that would normally be done by oral surgeons in the city. I had no surgeons around. And when I do this, the last 20 years, I never wrote a single prescription for an opioid painkiller. It is that effective. It didn't matter how complex the surgery was. The patients really had pain that could be administered with usually some anti-inflammatories like NSAIDs, but really I never used opioids. And with this opioid crisis, that's huge. In fact, I did talk to the Oral Surgeons Association talking about this. Basically, all I do is I take the tooth out, shine the light inside of it. It's real simple that way. And actually, Tom, if there's any dentists on here, he has his units, but there also is, excuse me, there's a dental attachment that goes with it. Something for everybody, cold sores. If you get a cold sore, when you feel the tingling with it, you just basically use a low dose, and it's going to, if you can catch it early, you can prevent the cold sore, or you can make it heal twice as fast. So one of the things, we'll cover more at the end, but if you want to cover something in the surface, red is best. Red is not going to penetrate as deep as the infrared. So be it 810 or 1055, those are your infrared doses. The 660 red is what you want to do is treat wounds on the surface. So if you got a cold sore, you just treat the cold sore. And where I also would treat is the lymphatic system. I don't know if you can see, just underneath, you've heard of people with swollen glands? That's the lymphatic system. That's the body's immune system. So if I treat that, I can make colds, prevent it from happening, or get rid of it twice as fast. Another thing that is probably one of the biggest things in PBM now, and Tom's actually doing some work with this, is mucositis. People that are having chemotherapy, a lot of the times they'll get what's called mucositis. If they're having radiation therapy in the mouth, 100% of those patients will have mucositis. And these are just a couple of pictures of mucositis. There's one. You can imagine what this is like. And this is not just the outside of the mouth, it goes all the way back into the throat. So this is the leading reason why people stop the chemotherapy treatment or the radiation treatment. Well, PBM can prevent or minimize the effects of it. And it is just a huge, huge thing. So there's a friend of mine, his wife just went through stage 4 pancreatic cancer treatment. And when they began the treatment, he did PBM on the inside the mouth and from the outside. And it was a very strong dose they were using for treating the stage 4 pancreatic cancer. And she never got mucositis through any of her treatments. When it was all done, the surgeon came, or these radio oncologists came to him and said, what did you do? Because she was the first patient that ever had gone through with this treatment with this chemotherapy agent, did not develop mucositis. So it's huge. In fact, right now, the Association of Oral Oncologists, this is the recommended treatment for mucositis. Before this medicine really had no answers. So these are dental things, but actually it applies to everything that's going on. So what we're going to do is actually, let me go back one, I'll go back. I got one of our, just did this afternoon. In medicine, some of the things you do is muscle and joint problems. It's very effective for that. In fact, when I was in practice about probably 30% of all my time in practice was spent treating head and neck pain on a referral basis. I was treating conditions like trigeminal neuralgia, which probably 0.1% of all the dentists would even look at treating. When in my practice, a lot of the patients that I saw, when people had TMJ treatment and it failed, I got those patients. And it basically, I would say my success rate was 95%. And it was actually so rewarding because so many of these people I saw, people had told them, I'm sorry, we can't be helped. You've got to live with the pain. So I would tell people, we're going to do the PBM. We can help. I can't say it'll be all the way better, but I know I can make it better. And I've had many of those patients literally crying in the chair with giving them hope because they thought they had no hope for anything. So, it really is phenomenal what you can do with this. In medicine, some of the things, like as I said, this is much the same as I did with the jaw. You can treat muscular problems. You can treat joint problems. So it's been shown to be very effective for that. Another thing it's extremely effective for is arthritis. I'll get to the home use, but I basically treat myself on a regular basis because I've got severe arthritis in my knees. I play golf. Well, so far this year, I played 55 golf games. So I play a lot of golf, and this is in Northern Canada where we've got a short golf season. But that's what I used to manage it. Athletic injuries, there's basically every single pro sports team out there has some kind of a unit. In fact, an awful lot of them now, and Tom may address it, is he's got like units that are treating the whole body. And this is what some of the sports teams are doing. And the other thing that's come out with this is you can improve performance. So they've done a study. They took the Norwegian volleyball team. I'll just give an example of one of the research articles. And what they had them do is they had them lift weights to the point of total fatigue. So as many repetitions lifting weights as they could do, they did it. Then half them went the next day and lifted weights again. Half them at the end of that first session, they put PBM in those muscles. Then they also, the second day, lifted weights. The ones that had the PBM after the first session, they actually could find they could lift 50% more and go longer the second day when they've had that. So it is, most sports teams are using this now for that as well. Another huge topic that's coming up, and I think Tom may address it because he's actually working on a helmet for some of these things, is some of the degenerative brain diseases. Parkinson's, MS, Alzheimer's, they're all being researched with PBM. In fact, right now in Hamilton, Ontario, there's a study going on. I'm not sure if it's totally filled now or not. So if you've got relatives, I can find out if they've got their full complement of patients or not. But they're studying Parkinson's patients. What they're doing, it's a study that was first done in Australia, and they're trying to repeat it here for Health Canada approvals for Parkinson's treatment. So what they found in the study in Australia is they took patients with mild to moderate Parkinson's disease, and they did the light on it 3 times a week, and they also did some exercise with the patients. And what they found was the patients that kept up with the PBM treatment, their Parkinson's over a 3-year period remained at that exact same level. It didn't, they made some slight improvements, but you're not fixing it, but there was no deterioration. Whereas those, if you had no treatment over those 3 years, those patients would have deteriorated a lot. So, I mean, this is a very exciting study for the Parkinson's because Parkinson's is a huge thing. In fact, all the degenerative brain diseases are becoming more and more prevalent as we age. Then the last thing we'll talk about is home use. So it's great to hear all these things that professionals can do, but where I think this is really going to be the future of PBM is for people to be doing it themselves. An example, as I said, with my knee is I treated myself. I was just out west, golfed 7 days in a row, came home and I golfed again. So I did 7 days, flew home, So I was cramped up in a plane from Vancouver for 5 hours and golf Monday. And actually, my knee started to get really sore after that game. So when I came home, I actually put up my knee, managed it. Golf today, absolutely pain-free. I mean, it's that simple. It is basically my first aid kit. But when we talk about this, the thing you have to remember is two things. One is red penetrates not as deeply as infrared. So if anything on the surface, you always want to use red. And Mike, what I think, if I'm going anything deeper in my body, shoulders, knees, hips, back, I'm going to use infrared. That's either the 810 or the 1055 wavelengths. They'll both penetrate quite deeply. Now, what happens is, I think Tom sent me some information, and they've been doing a study looking towards patients with mucositis. And I know one thing that they've got is if they shine the light on your cheek and it goes through, approximately 8% of the light goes through all the way through the cheeks into the mouth. So if I want to go deep in the knee, the unit, if you read the units, you're going to be about 25 seconds to deliver 4 joules per centimeter squared, and I want 8. So that's going to take about 50 seconds. But when I actually want to treat myself for my knee, I'm treating 5 to 6 minutes on 5 different places. So it's going to take that long, that much energy to get down to the base. So the further you have to have the light go in, the longer the time's going to be. That's arthritis in the knee. If I were treating arthritis in the fingers, they're right at the surface. I probably treat, a minute on each side of the finger, and that's all I need. So it's something you have to recognize is the deeper you go, the longer it's going to take. In fact, I travel a lot. I've retired from dentistry now, and I, usually take 3 or 4 vacations a year. And in the last 15 years, I've never, ever gone on vacation where I haven't taken my PBM units with me. What I take is I usually take my SunPower, and I also have like a small unit that I can go to very small areas. So I've got those in my suitcase all the time. And what's funny? Most of the times I've been on trips, I've used them. I haven't used them on me or my wife. Somebody else in the group that I'm with has had problems, and I've ended up treating them. But I think Tom may go into a lot of some of the things you can do at home. But when we get to questions, if you have any questions on different types of things, can I treat them? Can I treat them? How do I treat them? We're going to have a question and answer very shortly afterwards. So I'll stop talking now, and I'll turn it over to Tom. And then any questions you've got, this is really what we want. You ask your questions, and we'll try to answer them as best they can. And if I can't answer them, I'll do some research, and I'll find the answers for you. So Tom, Hondi, back to you.
Well, Gerry, that was absolutely excellent. I'm sorry, I know you so well, I call you Gerry, but
that's fine.
Dr. Ross.
That's my name. No, that's my name.
Dr. Ross here.
No, hey, Gerry's better. Gerry's better, Tom.
Okay, all right. So, Gerry, just a little insight. Where have you gone to teach about PBM?
Okay. I've actually lectured in all 6 continents. I've done over 250 lectures, and I speak at 2 groups of meetings. I speak at dental meetings where I'm speaking to the dentists and trying to introduce PBM to them. And then I also talk at the meetings of PBM where I'm meeting with researchers and clinicians in all different fields. I've talked at medical meetings, and what's happened lately, myself, a good friend from England and one from the US. In fact, the one I talked to, his wife had pancreatic cancer. We formed something called GMA Laser Education, and we have courses online that people can take.
Yeah, they're absolutely excellent courses to learn more about PBM. I thoroughly suggest those that want to dig deeper and learn more about PBM, definitely that's a course to take. And it's GMA Lasers.
GMA Laser Education.
Oh, there you go.
All you got to put in Google capital G, capital M, capital A, Laser Education. Put it in Google and you'll find it.
Yeah, no problem. It comes up first page because, well, you've been teaching a lot out there. So tell me, once you were on a trip somewhere and somebody hurt themselves.
Okay, well, there's a whole bunch of them happened. One was I was speaking in Dubai, and one of the fellows, Mel Birchman, who I speak with, he went out partying and overdid it and started doing some dancing and slipped and pulled his groin. So I got a knock at my door at 2 a.m. asking me to borrow my unit. Another time I was in Italy, and a lady got hit by a chain, cut her leg, so we ended up treating that. Last year I did a trip in Newfoundland, and one of the ladies on the bus tour, we were up at Axel Meadows, where the Viking settlements are, and to get to it, you have to walk through a wooden pathway through the marsh, and she slipped and fell, and basically damaged her knee fairly severely, and it was swollen to about 2 times its size. And they thought they were going to have to basically evacuate her and get her off the island to be the end of her tour. And I offered to help. And what we did is we put the PBM at the end of every trip. We did PBM in her knee. Her swelling would go down. She'd go for the whole day's tour, start to get swollen and sore again. We'd do it same thing every night. Now, the big thing is that's not my field of expertise. So in this case, I said, I am managing your problem. The first thing you need as soon as you get home, in fact, long before you get home, call your doctor, set something up for consultation with an orthopedic surgeon so you can get proper x-rays. But we actually managed to be able to treat it so she could finish the rest of her trip. In fact, the first time I did it, I went to the room and helped her. By the time we were about the 3rd or 4th day, I had 10 people each time watching me do it, wanting to know about it. In fact, there were about 3 people that ended up leaving at the end of it was a bus tour, but 3 of them ended up buying their own PBM units.
Right. Well, that's excellent. So what I'll do right now is I'll go into a little bit of a commercial here to explain a little bit about our light technology. If you can just for a moment.
PBM stands for Photobiomodulation. Photo being light, bio being biology, and light, well, light coming from some kind of source. In this case, PBM is used to help stimulate healing in the body, whether it's an LED, whether it's a laser, whether it's the sun, but that light comes through the skin layers, and actually the cells are able to absorb that light, converting it to energy, and then there's a host of different processes that are stimulated because of that light. So you can speed up healing, you can do different things that is very beneficial for the cells themselves, for healing, for reduction of inflammation, and a host of other things. Kerber USA is a company that we have set up to promote healing for the US and around the world. We would like to see this technology help a lot of people. We use LED technology where we can provide high amounts of light into the body, and that stimulates healing. I'd like to introduce you to the SunPowerLED Palm Ultimate. This device here has the most power of the series of devices. This light can produce a huge amount of light that can enter into the body and help speed up that healing. In this device, we have 2 different wavelengths. It's 660 nanometer, and as you can see, it's very bright, but it's very effective. You will cause a systemic effect with this wavelength of light. The other wavelength is 810. It's not very visible, but it penetrates very deep, and that can help as well reach the target that you're trying to reach. The main part about this light is that we have the power behind it and the large surface area that can reach very deep into the body. We believe that our product is the most powerful LED cluster under the sun. We have specification of this device of 150 milliwatts per square centimeter, and that is over this entire area of 40 square centimeters. It also provides a wall of light that comes through the skin and is able to reach depths that have never been able to be done before with other light products on the market. There's an interesting biblical passage in Malachi 4:2 that talks about the healing that comes from the rays of the sun. And that's what we're trying to do. We're trying to provide healing with these rays. PBM has also been shown in various studies to be able to help promote healing in wounds such as diabetic ulcers, venous ulcers, and other areas where cuts or burns or other types of wounds are on the skin level. If you have any questions about PBM and how our light device, the SunPowerLED Palm series, can help you, please reach out to us and we'll get back to you as soon as we can.
So I'll just go back a little bit. So although LED technology has really come a long ways in the last 18 years, I supplied my first powerful LED device was for dentists for curing the white fillings. And with the curing with blue light, we were able to take a single high power LED and activate the filling material, and we call that device the blue one. From there, the opportunity came where I was able to work with the doctor and find out that high power light could actually make a difference in the body. And it was at that point the LEDs would have been far too expensive yet to deliver high enough energy in the near infrared band. So I developed this device, rather large, and so that was going back already over 15 years. And this device would, well, you'd use it for wherever on the body, just like the smaller devices we have now. And we saw it help so many people, diabetic wounds to migraines to vertigo to just any arthritis in knees and elbows and other back pain issues. So we've had a lot of experience now going back to 15 years, and we continued to develop different products. And the last 3 years, we've developed the new LED devices in the small format. This is, we have several different devices. We have the Classic. It's a lower power single wavelength device. And then we have 2 units. We have the Palm Professional and the Palm Ultimate. Both of them have 2 wavelengths, 660 nanometer and 810. So as Gerry was describing, the 660 is a very, doesn't penetrate as deep, but still very, very beneficial to different things that are more surface. Not only that, it has the potential to be absorbed by the blood and cause a systemic effect, so the blood can carry it away from that area. Also, when you're dealing with the lymphatic system, 660 can be used, and as was pointed out, that for lip sores, somebody can use the 660 with this device. It also has the 810 nanometer. That wavelength you can barely see, but you can see it there. There you go. You can see it there. That's coming out of the unit, and it's actually quite powerful, but the camera can't pick it up, neither can our eyes. So that's 810 nanometer near infrared. The other device, so of those 2 devices, the next one along is the Ultimate, and the Ultimate is very similar, only it has 25% more power coming from the device. So we're looking at the power being over the whole area. This is what we call the wall of light. We have a trademark on it, wall of light technology, where we have a whole amount of light coming out over a large area. And what that does, it actually helps to penetrate deeper, because as the area expands where the light comes out of, it actually contributes to the depth that, and we did a lot of measurements on that. to see what would happen if we started with a small area and we took measurements through pork breast tissue. And we measured below the pork breast tissue and shone the light on the top. And as we got the area larger on the top of it, as we increased the area, even though it was the same power density, so it was in this case 150 milliwatts per square centimeter, as we got larger, the depth that we could measure at a certain depth, about 2 inches deep or 3 inches, we were able to measure higher and higher amounts of light as the area increased. So that's why I chose this amount of area, because it's very important to get not only, so 2 things, area, well 3, area, wavelength, and the power density is really critical. So that has the 660 nanometer, and you can see it going right through my hand there. There we go. And the 810, again, if this camera would pick it up, you would see it just streaming out of this device. Now, the short video that I had there, unfortunately, we weren't able to run it well. It didn't work great, but we have the this time. But we have the newest device, which is called our SuperPom 1050. So it has the 660 nanometer wavelength, just like the other devices, but it also has 1050 nanometer. Now, if I look at this, it looks like there's only one little tiny LED on it, kind of like what you see there. But again, if I turn it sideways, you can see the little lights in here. This is actually 1050 nanometer. So there is potential with the 1050 nanometer to penetrate even deeper. Now, for the dentists out there, Gerry was talking about, we have an adapter that allows us to put this into the device, and now we can get the light. I should have my glasses on, but there we go. So you can see the light coming out of the tip now from this device. So that's the fiber optic intraoral adapter. So we have these different devices. Now, as I saw, I ended up going through COVID myself. I ended up with double lung pneumonia. This was in January of 2021. January 2022. And I was able to use this device. This is our, what we call the mini canopy. That's what you see in the background here. You can see the mini canopy doing a whole area of the back. And this is the equivalent area of 15 of these palm devices, with roughly 15 times the power over this whole area. So total power is quite high. This can go any angle, twist down, go up and down on top of the, if you're laying on a bed, you can, or if you have a clinic, the person can lay down on the thing and then be able to turn on the wavelength that you desire and do the 10-15 minute treatment. So this is our mini canopy. And then we have one of our newest devices, which is our helmet. And the helmet has the potential to treat same thing with the 2 different wavelengths. And the most neat thing that we've been able to do is more recently, we know that the history goes way, way back, that 660 nanometer has been used for hair growth. And it all depends if the hair follicles are still in good shape. There's a possibility. There's the one wavelength, as I was showing you. And here's the other wavelength here. That's the 660 nanometer. So this is, as Gerry mentioned, there's promising signs in research about dementia, Alzheimer's, and other brain disorders. We've been able to see improvements for people with migraines and even seizures. As a matter of fact, one of the individuals who's been knows exactly where on the brain they have a brain lesion, and they've suffered with having seizures. And in this case, they were able to they were able to treat that spot on their brain with one of these palm devices. And I'm just going to move this out of the way there. There we go. They were able to use this for one of the palm devices and on that spot, and they've been seizure-free for 2 years, just using the palm every day on that area. And before that, they were encountering the seizures. They had gotten some PBM treatment at one of the at University of Buffalo, and then during COVID, they were 2 years seizure-free, and then during COVID, he ended up having it come back again. And in this case, what happened is he, because there was no chance of treating him, the professor said, "Hey, why don't you get one of Tom's units?" And that's what he did. And he's now been seizure-free for 2 years. We also have, I don't usually show this, but I'll just plug this in. If we can turn that on and roll it in. There you go. Oops. We also have our big canopy. I've just got it vertical right now. Well, you can't really see it very well over there, but it's the area of 6 of the mini canopies. So you can do a large part of the body with that device. I know I don't have that up on the website, but if you want to connect with us, we can give you more details on that. So now I'd like to go over to the question answers as I see them coming up here, and we'll be able to hopefully answer some of those questions. So we'll bring Gerry on, and okay, this is, I'll let you, Ross, the first one on this one. It says, there's a Dr. Charles Dobek. He says, can PBM be used during proton beam therapy? Does it help reduce the free radicals? Go for
it. There's actually not a lot of scientific studies on that. But I mean, if you wanted to do it, where you're going to be doing is treating the immune system. It's the lymphatic system is how would you go at it.
Right. You build the immune system to be able to tackle the issues.
In fact, there's a lot. That's one of the things, almost everything I treat, I also treat the immune system. When I talk of home use for people, I say everywhere you treat, you want to treat the immune system, nervous system, and the site of the injury.
Okay. Question come up here from about carpal tunnel treatment time. So if they have the SunPower device, which you've been using, what do you, what was
the funny thing is the original study on before PBM was low-level laser, everybody that's using the studies for the FDA is based on studies on carpal tunnel syndrome. It was done with United Auto Workers with people in the repetitive stress injuries. So what you want to do is you want to treat the lymphatic system in 2 places. One is inside the elbow. I don't know if you can get, so just the outside the elbow here and under the armpit. For those 2 areas, you want to use red and you want to do 4 joules per centimeter squared. And it'll give you the time on it. Then you want to do the spine, whichever side you've got the carpal tunnel on, treat the spine as well. Mm-hmm. And now normally you would do 8, but because it's got to get into the spine, I would increase my time by 4 times. So you want to do 32 on the spine because you want to reduce the nerve conduction. Then you're also going to treat both sides of the wrist. So I would do about 8 joules on each side of the wrist and then on the hand itself. Now, it's been shown, there was a study done, there's a company in Toronto called Meditech that also has LEDs and laser units, and it's run by physicians. They did a study on it, and they found if there was not a lot of nerve conduction damage, they knew nerve conduction studies, the results of that were exactly the same as surgery. It was about an 84% success rate. Now, the catch is, if you do surgery and it doesn't work, if you're that 15%, you're out of luck. If PBM doesn't work and you're that 15 where it doesn't solve the problem enough, you can resort to surgery, but you can never go back if you do the surgery. So as I'll just put it to you, which would you rather have on you? Shine some light on you or have surgery?
Yeah,
so
exactly.
It works extremely effectively.
I've had people in the braces and with severe pain, and to see them a year later, no surgery, and yet they're pain-free and no wrist straps or any of that.
And Tom, as I said, if people ask these questions and want more detail or want me to write these things out for them, all I do is contact with you, and I'll send everything out as far as what you're looking at times and where to treat.
Excellent.
From there.
Excellent.
So if somebody needs it, I'll help everybody. I answer probably 3 to 4 emails a week from different patients from all over the world.
Okay, so a question came up. Actually, 2 questions I'll address is from Diane, and also Diane and Craig, and they both are asking a little bit about the intraoral. So Diane mentions about, would you use this up your nose? Well, as a matter of fact, with the amount of, if you have, with the palm device, with the amount of light that you have, you can use some glasses to darken from the front here. You can wear those little Speedos with the dark lenses on them, but you can actually treat, this light here is going to go plenty into the nose without having to put some kind of device up.
Actually, I would still go in the nose, Tom.
You would? Okay.
The reason why is it's very simple. If you go in the nose, you're directly at the blood vessels you're trying to do. If you do it from outside, you're losing a lot of the energy. Yeah. I'll just tell a story with that. I had stage 4 prostate cancer 12 years ago. I had traditional treatments, but in addition to that, I also knew, hey, red light is absorbed by the blood. So every time I had a radiation treatment, and for about 6 years afterwards, I had on a daily basis, I put red light into my nose. So basically what's happening, if there's cancer cells, the light is carrying the immune factors, it stimulates the T lymphocytes, the natural killer cells, to attack those cancer cells. And bottom line, 12 years after that, I am totally cancer-free. My PSA is 0. So I don't, as I say, I don't know if the red light did it all or traditional treatments. I don't care. I'm here.
That's right. That's right. So they've also mentioned that the light with the optical probe can actually direct the light to the back of the mouth. And yes, it can, because look at the length that I have. And just to show you, you can see the light coming out of the probe. So I can put, as you can see there, sorry, I'm not doing a very good job of it, but anyways, it's a little harder on the camera.
See, I'll treat wisdom teeth at the back of the jaw, but also if I'm getting a cold, what I do is I treat the neck lymphatics, and I use the small dental probe on the tonsils. And if I'm getting a cold, I can basically, most cases, eliminate it. One time I did get a cold, and I went through the full cold symptoms in 48 hours.
Yeah.
So, yeah. But I mean, I was using it on my tonsils, so it works great in the mouth.
Well, the crazy thing is with kids, you don't have to tell kids or whatever. If they know something helps them, it's really funny. My grandkids now, they'll bring the light to their parents to kind of say, hey, I need something. My throat is sore. Even it's been pretty wild. Their belly upset.
Another thing I did, 2 things actually. You can use it to prevent nausea and gagging. So if somebody has got nausea and gagging, and it actually helps with hangovers too. It's called P6 in the wrist. So if you use that big unit, and put it over your wrist, on both wrists, you can reduce gagging and nausea.
Excellent.
And also a lot of my children's dentistry, I used to use PBM instead of needles for kids, and did their work.
So another question is, I have a cyst on my vocal cords, and treatment recommended is surgery in the OR. So one thing is that, yeah, you can definitely, it's good to use this as a pre-treatment, but also not only a pre-treatment, but also for after the surgery is done. The other thing is, I've had people with nodules and cysts on their in their throat area, and after a month, 2 months, they're gone.
Yeah, and you want to do the lymphatics in the neck. That's where you want to treat it, and you're going to treat both sides. And you want to, if you want to do it before surgery, that reduces the complications of surgery and reduces post-op pain.
Well, I also have a person asking this. I have a Super Pump 1050 with the intraoral attachment. Recommended procedure for surgical third molar extractions, pre-op and post-op.
Okay, real simple. And bottom line, I do this day in and day out with it. What you want to do is, first thing, no, I don't know, this is before you go and have the surgery. The day before the surgery, the morning of the surgery, you want to treat the lymphatics. And if need be, I'll send a diagram where they are to you. And then you also want to put it over top of where the surgery is going to be done. So do that the day before, in the morning before the surgery. Now, if the dentist is really nice to you, what I would ask him to do is, when he takes the teeth out, before he stitches it up, you want to hold it inside where the extraction was done. And usually your lower molars have 2 roots, your upper have 3. You want to go 16 joules down each of the roots. And then he can stitch it up. And then what you want to do after he stitches it up, you want to do 4 joules, so 16 joules with the red. Very important, it's the red. Or sorry, no, the infrared for the extraction. Then when he stitches it up, it's the red. Because as we said earlier, red's absorbed by the blood. So if you shine red, it's not going to go down to the bone. And you can reduce your swelling by about 75%, and you can reduce your post-op pain by 90%. So again, I'll give you the full protocols if you write to me, and I'll send diagrams. And
with all my kids and my their mates, they have had, a number of them have had wisdom teeth removed, and they never needed any painkillers. They did the light treatment as soon as they did things, and even anytime the pain would start coming back, they'd right away use the light again, and pain would be gone.
Well, I'll show you, Tom. I'll just give you an example of this, how effective this is. This is back about a year and a half, 2 years ago. I had a young lady who goes in and does surgery in people's offices. And she'll, like, if you need your wisdom teeth out and the dentist isn't experienced, she'll go into their office, do the wisdom teeth. And she'd heard about PBM, and we had a long discussion about it. And she bought a PBM unit. And the next week, all the patients she did that week, so we had a 20-minute discussion. She never took any courses, just how to do it. Every patient she did the wisdom teeth that week, not one of them needed an opioid. And in fact, right now, she advertised in the dental journal. And she says, I'll come into your office doing surgery in your office, and I offer PBM treatment in your office. I mean,
fantastic.
We've done webinars, and she said it totally changed. Like, literally, she went from writing prescriptions for opioids every single patient to never writing one after that.
Okay, has Dr. Gerry seen any cure of gum infection using these lights?
Yes. Actually, there's some studies that just using PBM, where it actually is extremely effective, is surgical lasers as well as PBM. So what you want to, again, it's actually a lymphatic system. So depending what's going on, I can help you, but there's, as I say, gum disease, we got a whole broad range of what's going on. and how serious it is. But I mean, it was an adjunct that I used. Every single patient that had any gum problems, I used the light with it. In fact, when I talk, there's some studies happening now. Gum disease used to be thought as a bacterial disease. Now the new studies are gum disease is an autoimmune disease, like rheumatoid arthritis, like lupus. So what happens is the bacteria, you're allergic. Everybody doesn't get gum disease. The sensitive people get the gum disease, and they get the reaction to the bacteria. The body then releases the toxins that break down the bone. So that's why PBM is extremely effective, because now you're dealing with an immune reaction.
Wonderful. There's Kate Jones. I would like to say I'll make sure you get the diagrams that Dr. Gerry is talking about here for the protocols and the diagrams, okay? So another question came out from Diane. She asked, how could you use this for cavitations?
Basically, cavitations is people don't know what cavitations is. What cavitations, the theory of cavitations is you get like a low-grade infection that stays in the bone that's not really showing up. So what you want to do is, again, like a broken record, the key thing is the immune system. So you want to go a dose to the submaxillary lymphatics. And the other thing, when you're starting off, I'll treat the lymphatic duct, which is between the first and second rib. That's where the lymphatics empty into the bloodstream. So you go centrally out. So I treat here, then I treat under here. Then you're going to be treating a fairly high dose into the bone, because now any of the cavitations are inside the bone itself. So, yeah. But the key thing is the immune system. It's really the key to so much of everything we do with PBM.
We had, we've now seen a couple people with infection in the bone. One person had lost a significant part of their jaw, and it had been going on for a very long time. She was going through all the standard treatment modalities, but was still having continuous erosion of her bone. Anyways, she started with PBM with our light, and there's new bone growth in the area, and the infection has stopped, and she's thrilled. I mean, it's also the toxins that are being dumped from an infection has all sorts of effects on the body, and she's been able to see tremendous impact in her life by using PBM. The other thing was another person had infection on their bone by their ear and on the skull, and they've lost, they've had 60 years of surgeries in that area, never cleaning it up. Gave him one of my devices. I know him quite well, and it says, I didn't know about it, but it says, just here, give this a try. 1 week later, everything just moved out of that area, and he was thrilled because no pain, and the infection is gone ever since.
Well, another thing that a number of women are on bisphosphonates. They're taking them for osteoporosis. It's the #1 treatment for osteoporosis. And there's a slight incidence, they're not sure of the studies, anywhere from 1 to 1,000 to 100,000 of the women, if they have surgery, the bone won't heal. And they've done some studies where if they're using PBM, they can actually get the bone to heal. Actually, what they're doing is sometimes using PBM with hyperbaric oxygen gives the best results.
Right.
That's another study that that's another use that it comes in for.
Okay. How do you treat the lymphatic system? And well, you were showing that. You were demonstrating how you treat under here.
It depends where you want to go. I have the diagrams of the full lymphatic system for the body. In the arm, anything in your upper body, You want to always start off with the armpit, then treat in the elbow, treat the lymphatic duct. Lower body, you want to go behind the knee and the groin first, then behind the knee.
Yeah.
And that's, okay. As I say, I've got diagrams of the whole lymphatic system of the body.
All right. So here's Craig, and he says, Dr. Gerry, 231 is gone. Root canal and then removed a year or two later. 230 is improved since 31 removed. Jawbone around the both has returned. However, there is still soreness around the root of 30 about half the days of the week. Sometimes it feels totally fine, then seems like it's coming back. Maybe this can clear the infection. Sounds like you have to treat the immune system. So that's what he wrote. So if you want to.
Okay, well, first of all, as I say, without knowing all the details, without x-rays, without looking at things, if people have looked at it and there is an infection, probably what it is, chronic pain can induce what's called neuropathic brain pain. So the pain is now in the brain and not in the site where your pain is here, but it's coming from the brain. So that's one of the things I used to treat a lot were the patients. Remember I said I got everybody's failures. So you can treat the area with lymphatics and treat the nervous system in the area. So a high dose along the nerves of the area. What you can't do, what I used to do is I also treated the brain. I treated what's called the trigeminal ganglion, and that's where that nerve comes out of the brain. And that's how I'll help manage those patients. But for home use, I would actually be just treating the nerve. I'd take the dental unit, treat the nerve along that area. I think this is a patient from US. I think that's the lower right, first and second molars he's talking about. In Canada, we use a different numbering system. So you want to treat the nerve. Again, I can contact me. I can give you exactly what to do with the dental system. If you're using it, which unit have you got? And I'll give you exact times for everything and where you treat it.
Well, I think we've cleared up most of the questions. There might be still one or two yet, but it looks like so let's I think we'll wrap it up for today. I want to thank you, Gerry, for sharing the wealth of knowledge that you have.
I have fun doing these. We've done a couple of these already. I have fun doing it. I have no problems talking, you know that.
So I'm hoping that our guests have been able to learn a lot. And I, again, thank you for all those that have joined us tonight. And we're not going to have a webinar next week. I've got some things coming up. So we're going to be back in 2 weeks, Tuesday, September 5th. So I hope for you all the best in using PBM and how you can help yourself and those around you. So all the best, everyone. Have a great day. God bless. Thank you, Gerry.
Have a good night. Thanks, Tom. Be well. Take care, everybody.
Okay, bye for now.